Well, thank you so much for your time today and for joining our webinar, SSP has changed and why your absence strategy must change too. Over recent months, both before and since the SSP change, we've seen significant increase in inquiries from businesses looking to understand how Doctor Care Anywhere can help mitigate this impact. That growing demand is really what has prompted us to hold today's session to share with you what's changing and what it means for employers and how business can make a more proactive approach to managing absences. To help bring this to life, I'll start with a quick introduction. So I'm Rebecca, Business Growth Lead at DCA. I've been here for a couple of years, but been working in healthcare for over 20 years, working with insurers, providers and employers to develop solutions that really support workforce needs. I'm now going to hand over to Patrick for a short introduction.
Thanks, Rebecca. Hi, everyone. I'm Patrick Roberts. I'm one of the clinical directors at Doctor Care Anywhere. I've been working at the organisation for just over a year and a half. My background is I trained as a physiotherapist around 11, 12 years ago, and my clinical experience has been almost exclusively in musculoskeletal care, with kind of healthcare management being my most recent kind of experience in the private setting and the public sector. Nice to meet you all.
Thanks, Patrick. So with the introductions covered, let's start by looking at what SSP changes actually mean in practice for small businesses. So as we all know, SSP now starts from day one, and previously employees earning below £125 per week were not entitled to SSP at all. That earning threshold has now been removed, bringing lower paid and part-time workers into the entitlement for the first time. When you factor in things like a 2-week wait to see a GP, it's easy to see how this could lead to longer periods of absence and an increased cost for employees. Alongside this, we also believe there's a second risk, particularly for SMEs, where people might avoid taking time off because they're part of a small team and are really committed to working for that team. So now we sort of set what's changing, shall we have a look at what's driving the absences in the first place? So what we really consistently see is that to mitigate the absence of changes, businesses need to focus on what the most common causes of absences are. So what we see here at DCA of mental health and stress, musculoskeletal pain, so things like back and neck pain and repetitive strain. We also see a lot of cold and flu-like illnesses and minor disruptive conditions such as stomach issues, skin conditions, rashes, etc. And these issues tend to be the ones that drive repeated absences. They worsen without treatment and can ultimately lead to a longer time off. And that's exactly where the right support and early intervention can really make a difference. So if these are the challenges, the next question is how do we actually address them? So at Doctor Care Anywhere, we have a solution in place that enables early intervention and support for employees to return back to work more quickly through 24/7 and 365-day access to our digital primary healthcare service. Our service is accessible both via web browser and app, and appointments are available typically within 2 hours. Booking is simple and efficient, and it takes just 90 seconds, typically 6 clicks. And we pride ourselves to ensure that users are directed to the right clinician the first time. So our network includes GPs, advanced clinical practitioners, mental health specialists and physiotherapists. So for an example, if a user looks to book an appointment and they put in that they've got knee pain as their symptom, they'd be directed to a physiotherapist for a video consultation and triage. And at this point, I'm just going to hand over to Patrick, who can talk more in detail about the MSK physiotherapy journey.
Thanks, Rebecca. So yeah, afternoon, everyone. So I'll just be covering the topic of musculoskeletal disorders in the workplace, the impact that has on absenteeism and presenteeism in terms of the cost and the productivity, the benefits of having a physiotherapy service input, and the approach we have at Doctor Care Anywhere in terms of managing musculoskeletal disorders. If we go to the next slide, please, Rebecca. Okay, so why is musculoskeletal pain an important topic to consider in the workplace? We know that it's the second most common reason for long-term and short-term sickness after mental health. It accounts for around 17% of all sick days in the UK, and that amounts to over 20 million lost working days annually. So you can see the gravity and the impact musculoskeletal pain has on workforces. In terms of quantifying the cost that it has on the employer, we've got a case study that highlights the cost of sickness due to musculoskeletal pain. So this was a report from Rolls-Royce over a 12-month period, and they found that around 39,000 sickness absent days were due to musculoskeletal pain. So the impact that has on a monetary perspective amounted to around £50 million. So it really brings to light the reality and the gravity of the problem and the importance of addressing it. If we go to the next slide, please. So this slide covers the challenges of musculoskeletal issues in the workplace in terms of specific ailments and occupational associated risks. So the Health and Safety Executive outlines the prevalence of MSK body parts, musculoskeletal body parts responsible for sickness in the workplace. And that's outlined at the box on the top that you can see there. So pole position, unsurprisingly, is lower back pain as the most common cause of musculoskeletal disorder in the workplace, followed by upper limb, neck symptoms, both being kind of second most common cause. And then you've got other things like hip, leg, knee, foot and ankle pain. So effectively, it's all regions of the body causing sickness absence, but lower back pain is the most common cause here. Just kind of drawing your attention to the box in the middle in terms of causes of MSK pain in the workplace. The most obvious thing that comes to mind is manual physical jobs associated with a certain occupation. So lifting, carrying, pushing, pulling type activities. But there's other kind of tasks and activities that are responsible for a significant volume of MSK related disorders. And these are all demands that might be repetitive in nature or unilateral in nature. So factory pickers, for example, or packers, where there's lots of repetition or loading in one particular movement position or plane of direction. But also your office workers, where their demands in terms of sustained postures and positions for extended periods of time, that's also going to lead to musculoskeletal pain in the workplace. So other things to consider, occupational things. So surgeons and dentists quite often see those where they're stood or sat down for an extended period in a position that's awkward. That's going to lead to musculoskeletal pain. And then finally, considering those that already have a pre-existing musculoskeletal condition and the impact that's going to have on the demands at work. So you can see at the bottom here, 17.8 million UK citizens are already living with a musculoskeletal condition. So 17.8 million against a population works out about 1 in 4 people. So it's fairly significant. If we move on, thank you. So looking here at absenteeism and presenteeism. So this is from Gov UK, some of the figures they've got there with MSK related causes due to absenteeism and presenteeism. You can see the data there. So absenteeism, 9.5 million, presenteeism as well. So the definition, absenteeism off work due to sickness, presenteeism at work, but they have a reduced or reduction in their productivity due to the sickness. So they might be on modified duties or phased implementations of the duties associated with their job. The best way to manage musculoskeletal pain is with physical activity and exercise, both for long and short-term conditions, but also, as a preventative measure to avoid flare-ups of musculoskeletal pain. So if we can promote exercise and physical activity, we should expect a reduction in absenteeism and presenteeism. If we go to the next slide, please. Okay, so what we're looking at here, this is a multi kind of case study from 2024. So this basically gives a comparison between a GP-led service against a FCP, first contact physiotherapy service in a primary care setting in terms of managing musculoskeletal pain. So we're looking at the benefits of patients seeing GPs versus patients seeing physiotherapists who present with muscle and joint related pain. And what we can see is that if a patient sees a physiotherapist, generally their symptoms are going to improve over a shorter period of time. They're going to have less prescriptions and less dependency on medication. It's obviously more cost effective because physiotherapists are a cheaper alternative to seeing a GP. Physiotherapists are also like the subject matter experts on muscle and joint related pain. So the assessment is going to be more detailed and more comprehensive compared to that of what a GP would undertake. And yeah, kind of clinical outcomes, you're going to see an improvement overall in seeing a physiotherapist as opposed to a GP there. If we go to the next slide, please. So what's our solution at Doctor Care Anywhere? So it's essentially having an established physiotherapy workforce that is responsible for the triaging for all muscle and joint related health concerns. Any patient that presents in with muscle or joint related pain, they're going to be triaged first by a physiotherapist. We know that physiotherapists, as I mentioned previously, are the subject matter experts in muscle and joint related pain in terms of taking that detailed assessment that leads to better MSK management. We know that patients' clinical outcomes will be better in seeing a physio compared to another clinician, recovering sooner with less kind of unnecessary referrals and prescriptions. And we know that patient satisfaction is going to be better with a physio for musculoskeletal pain compared to in a different kind of clinical group. So the significant cost savings in embracing a physiotherapy first service as opposed to a GP-led service in managing musculoskeletal pain. If we go to the next slide, please. What we're looking at here is our, I suppose, journey in terms of patients presenting with muscle and joint related pain. So starting from the left, they'll have a triage consultation first and foremost with a physiotherapist. And then based on the outcome, most of our patients are self-managed. They're not referred, they're not prescribed. They're self-managed with advice, education, but most importantly, an exercise management program. And what I'm going to do is just play a video on the right here. Hopefully the audio will come through, and it just gives oh, sorry, Rebecca, maybe you can play it, because I just realized you're sharing the slide deck. And I'm going to shut up for a second. Hopefully you can all hear this. It's just given an audio description on what the patient is expected to do from an exercise standpoint. All right, so what we've demonstrated there is an exercise platform that we use called PhysiTrack. So we use this for all of our patients with musculoskeletal pain that are self-managed. So the benefit of using this software is we can bespoke and tailor a specific exercise program for the patient's specific musculoskeletal condition or diagnosis. The exercises, they all have videos, as you can see. There's a descriptor, and you can kind of modify the volume, the dosage of exercise. It can become dynamic over a period of time. So some exercises, for example, lower back pain for week 1 will differ from weeks 2 to 6 to 12. So we can kind of modify all of that. We can also monitor and track patient adherence and compliance with exercise. We realized that one of the main failings of physiotherapy historically has been patients being non-compliant with exercise, and using a software like this kind of keeps patients honest, and we can understand what they're doing when they're doing it, and if symptoms aren't improving due to poor compliance and adherence to exercise, then we can advise this towards patients. So it's a really good software and platform that we use, and patients love using it, clinicians love using it as well. And I think that's it for me. I think I'll hand back to Rebecca.
Thanks, Patrick. That was really helpful. So we just wanted to sort of demonstrate one of our clinical pathways just so it could bring it to life. And then we're just going to do one little more section, and then we can take any questions. So we've talked about how SSP changes the stakes, and now we want to look at how we can change those odds. So we've heard from Patrick about how our MSK pathway helps people get treatment faster. And what's important to note is that over 80% of individuals that follow that pathway become symptom-free after completing the programme. So you can see from that statistic how that might really improve kind of getting people back to work faster. But this focus on faster access runs across all our clinical services. And we believe that early intervention means fewer lost working days and reduced presenteeism, which leads to a stronger performance for teams overall. So we believe it's not just good for business, but it's a benefit that employees generally value and actively want access to. So what this all comes down to is simple, that healthier employees drive a stronger business. And the outcomes we've talked about, faster recovery, fewer lost days, and better performance, are only possible because employees can actually access the care they need when they need it. And that's what I'm hoping to bring to life on the final slide, which is why 24/7 access really matters in practice. So what we find through our kind of looking at our usage is that it's not just a nice to have. Up to 10% and sometimes over that 10% of our appointments happen outside of traditional hours. So this is about real life need and not convenience. We see quite a lot of people phoning in at midnight talking about their sick child or they've got a bad back, and we can address those concerns imminently and we can prescribe whatever is needed. We believe that access drives outcomes, so faster access can lead directly to a faster recovery, which in turn reduces lost days and reduces presenteeism. And we're built for today's workforce, so we support shift workers, parents and carers, office workers to make sure that our healthcare fits around real lives. Not everyone can take a Tuesday morning off. Some people can just fit in an appointment at lunchtime, but we're there for everyone to access an appointment at any time. And we drive consistently high quality care. So the same clinical standards is applied whether it's a 10 a.m. call or a 10 p.m. call. And we provide a complete joined up clinical journey and support. So we have GPs, physiotherapists, as Patrick's discussed, mental health practitioners, and it's all in one place, easy access for your members or employees. And importantly, this isn't just impactful, it's also incredibly cost effective. So for less than £1.50 per employee per month, we can deliver real measurable outcomes. And for those on the call today, there's also an exclusive 10% discount available off these prices. So it's a great time to take advantage of this. And now we're paused to see if there are any questions.